All right, I'm going to go over the actual physical assessment checkoff sheet again, 1 through 10, and what's required. And then if it will let me, I'm going to try to actually show you a visual. First section is the general survey. So you're going to come in, you're going to introduce yourself to the patient, you're going to explain what you're doing. You're going to explain that there's going to be times that you may need to touch the patient, that you may be performing percussion, like lightly tapping on their skin. You need to describe to them what you'll be doing. Then you're going to say, I'm going to go wash my hands. You'll go wash your hands, and as you're washing your hands, you'll verbalize that you've already done your vital signs, you've already done your height and weight, and you've done the Snellen eye chart that was 20/20, and both eyes without corrective lens, which optic number 2, cranial number 2 optic would be intact. Then you would assess the level of consciousness, the patient's alert, they're oriented ×4, and responding to questions appropriately. Body size and proportion, they are normal. Weight is normal for height, and build proportions are normal. As I'm looking at their posture and their positioning, they're erect, they're sitting comfortably, and their arms are relaxed. I noticed when they came in the room, they had a normal gait and balance and stance with no involuntary movements. As I look at their facial expression, it's appropriate, they're smiling, they're comfortable, cooperative, and pleasant for their mood and affect. As I look at their dress and hygiene, it's appropriate for the conditions, they're neat and clean in appearance. Now I'm going to go to the head and the face. I'm looking at the size and position. It's normal cephalic. As I'm inspecting the hair, I can see that it's brown, shiny, with normal distribution. As I'm inspecting the scalp, I see no discolorations, no scaling, no nits, no inhabitants. As I'm palpating the scalp, tell me if you feel any tenderness. No tenderness noted, no nodules, no masses, no thickness. Then I would palpate the frontal and maxillary sinuses. As I'm palpating your sinuses, please tell me if you have any tenderness. I would palpate each sinus, no tenderness. I'm looking at the facial features. They're symmetrical upon inspection. Now I'm going to assess cranial nerve number 5. Can you close your eyes? I'm going to take this cotton ball and I'm going to touch your face and scalp. Tell me when you feel it by saying now. Now, now, now. Cranial nerve number 5, trigeminal, is intact. Now I'm going to assess cranial nerve number 7. Can you close your eyes tightly? Can you frown? Can you smile? Cranial nerve number 7, facial, intact. Now I'm going to put on my gloves so that I can check the oral pharynx. As I've got on my gloves, I'm getting my tongue blade out. I'm going to look at the lips and the gums. As I'm looking at the lips, I note that they're red, moist, with no cracking or lesions noted. The gums are pink with no inflammation or lesions noted. Now I'm looking at the teeth. I see no caries or malocclusions. The teeth are white, straight, and clean with a few fillings noted. Now inspecting the buccal mucosa and tongue. I see that the mucosa is pink, smooth, and moist. The tongue is pink and even without lesions. I'm going to take this gauze and look at the tongue, really good for nodules. As I'm inspecting the tongue, I see no nodules. I'm going to lift up the tongue. I see no nodules underneath. I'm going to palpate underneath. I palpate no nodules. Can you stick out your tongue again? There's no abnormal movements or fasciculation, so cranial nerve number 12, hypoglossal, is intact. At this time, can you say ah? I would take my tongue blade, look at the back of the throat. The uvula rises to midline. As I'm looking at the tonsils, there's no exudate or drainage. They're pink, and I would grade them a 2+. The pharynx is also pink. I would look across the second upper molar, and as I'm looking into the cheek, I see that the Stenson's duct or parotid duct has no inflammation or swelling noted, so cranial nerve number 9, glossopharyngeal, is intact. I'm assessing the integrity of the hard and the soft palate. As I'm looking at the integrity of the hard and soft palate, it's hard. The hard palate is white with irregular rugae, and the soft is pink and moist. I'm going to assess chewing now. I'm going to put my hands on your cheek. Can you chew? Bite down. Cranial nerve number 5, trigeminal, intact. I'm looking in the mouth for saliva. There's adequate saliva. Cranial number 7, facial intact. I'm not going to assess the gag reflex, but if I did and it was present, glossopharyngeal, cranial number 9, intact. Last thing I'm going to assess is swallowing. Can you swallow for me? Cranial number 9 and 10, glossopharyngeal and vagus are intact. Now I can either leave on my gloves or take off my gloves. Looking at just the external nose, it is symmetrical. And the internal nose, as I'm looking at it, first I'm going to assess for patency. So I'm going to close off one side of your nair, and I want you to breathe in the other side. And both nairs are patent. Determine the color of the turbinates. I will be able to see the middle and inferior, but I will not be able to see the superior. I want you to tilt your head slightly back. I'm going to lift your nairs, and I'm going to look inside with a light. I see that they're light red, and they are intact. I'm going to assess for drainage and exudate while I'm in here. No drainage, no exudate, no lesions or septal deviation is noted. Now I want to assess your sense of smell, which will assess cranial number 1, olfactory. Can you close your eyes? I will close one side of your nair off and put a scent under your nose and tell me what this is. Coffee. Other side. Lemon juice. Okay, cranial number 1, olfactory is intact. Now we're going to move to the eyes, and I'm going to take off my gloves and wash my hands again. And like I said, you can leave them on or off for the nose. That's up to you. I'm getting ready now to assess the cardinal fields of gaze, which will assess cranial number 3, 4, and 6, which are oculomotor, trochlear, and abducens. This is going to assess for EOM, the muscle strength. I'm going to put my finger in front of you, and I'm going to move my finger. I want you to follow it with your eyes only as I move around clockwise in 6 different positions. Back and forth, back and forth, back and forth, back and forth, back and forth. Cranial nerves number 3, 4, and 6 intact. I'm looking at the eyelids. I see no drooping, discolorations, or masses noted. I look at the eyelashes. They're evenly distributed and placed appropriately. As I look at the sclera, conjunctiva, pupil, and iris, I'm looking for the color and inflammation. The sclera is white. The conjunctiva is clear. There's no swelling or lesions noted. The iris is flat, round, with even color, and the pupils are 4 millimeters. Now I'm going to palpate and inspect the lacrimal ducts. There's no swelling, no drainage on either side of the lacrimal ducts. Now I'm going to move to the internal eye. I've already verbalized the Snelling eye chart. I'm going to assess for pupillary size and reaction. They were a 4 and went to a 2, so I would document that 4/2. I assess cranial number 3, ocular motor, intact. Now I'm going to assess direct and consensual light reflex. I'm going to take the pen light to the side of your eye, and there is direct consensual reflex. It constricts, and as I look at the other eye, it's also constricting, so consensual reflex is intact. Now I'm going to assess accommodation. Can you look far off on the wall? The eyes have dilated. I'm going to bring my finger in, and as I bring it in, look at my finger. The pupils are constricting, and as I bring it in towards your nose, they're converging. Constriction and conversion is intact, so accommodation is intact. I'm going to take my ophthalmoscope. I'm going to dim the lights. I'm going to set it at 0 diopters, and I'm going to approach the patient at a 15-degree angle. And I'm going to obtain what's called the red eye reflex. Red eye reflex is intact, and I would do the same thing bilaterally with the other eye. And remember, you can say that. Now I'm going to move to the external ear. The position and alignment, they are equal in size, appropriate position and alignment. As I'm assessing the auricles, there's no discolorations or masses noted to the auricles. I would palpate the auricles in the tragus. They're non-tender. I don't notice anything on the nodules, any nodules or masses on the auricles or the tragus. As I'm getting ready to palpate the mastoid process, remember that's right behind the ear. There's no swelling. Is there any tenderness noted? No tenderness noted to the mastoid process. Now I'm going to assess for auditory acuity, which will test cranial nerve number 8, acoustic. This is the whisper test. I'm going to distract one ear by pushing in and out of your tragus while I whisper another two-syllable word in your other ear, and you tell me what it is. Baseball. Baseball is correct. Cranial nerve number 8, acoustic intact. I would do the same on the other ear. As I'm going into the ear with the otoscope upside down, I am looking in the ear canal and I see no swelling or drainage noted. I am visualizing the tympanic membrane as I pull the pinna up and back. It is pearly gray. I also see the cone of light at 5 o'clock in the right ear. As I follow the cone of light up, I see the umbo, the manubrium, and the short process of the malleus. I would do the same in the other ear. In the neck, I'm inspecting the symmetry of the muscles. The neck muscles are symmetrical. There's no tenderness noted upon palpation. I'm going to assess for symmetry and movement and strength of the trapeze, which will assess cranial nerve number 11, spinal accessory. Can you move your shoulders up against resistance? Good. Cranial nerve number 11, spinal accessory, is intact. Now I'm going to inspect and palpate the thyroid gland. Can you swallow this water? It is rising. I'm going to get behind you, so I will get behind you. Could you sit up straight, lean slightly forward and to the right? I'm going to displace with my left hand, bring my right hand around, and can you swallow this drink of water? Thyroid is non-palpable. That's normal. Now I'm going to palpate the carotid arteries for amplitude one at a time. And now I'm going to auscultate each carotid artery one at a time. No bruise are noted. Now I'm going to do range of motion of the neck. Can you bend your neck forward, back, towards each shoulder, and all the way around. Flexion, extension, lateral extension, and circumflexion are all intact without limitations. Last thing I'm going to do is check the lymph nodes and lymph chains in the neck, starting with the pre-auricular in front of the ears. I'm going to do pre-auricular, posterior auricular right behind the ear, occipital at the base of the skull, submandibular or submental under the chin, submandibular under the mandible, tonsillar right under the earlobe. Go down just a little bit, superficial cervical, down that muscle, deep cervical chain until you get to the V. That's the posterior cervical. Then have them lean forward and hunch their shoulders, and that's supraclavicular. No lymph nodes were noted or palpable at this time. And that is 1 through 10, which I covered. So I hope that helps to go over that a little bit. All right, I also I'm also going to try to do a video to that as well, but it has not been cooperating with me. But if nothing else, you at least know exactly what's expected in each one of those sections and how to answer that. Of course, your partner may have something wrong with that area. You may not be able to see. They may have earwax on there that you cannot see the landmarks, and you would just have to verbalize that. So I hope this has helped. Thank you.